All right. So welcome everyone to August's Maine State Breastfeeding Coalition meeting, which happens to be during World Breastfeeding Week. So happy World Breastfeeding Week to everyone. We're so glad you're here. We have a great week of events that we've already experienced, and we have more to come. I think what I might do is actually share my screen so you can see what we have coming up still. So can you all see? It's essentially the website that has our flyer. It's a little bit blurry on my end, but hopefully you can all see that all right. And so Monday, we shared out the Diversity, Equity, and Inclusion Parent Panel recording. That was from the BEST conference for those of you who had signed up for that. And on Tuesday, we had our virtual breastfeeding group, which was the Maine Medical Center breastfeeding group. Yesterday, we had an incredible presentation about breastfeeding data from Erica Lichter and, oh gosh, I'm forgetting her name. Bear with me here. I have it nearby. It was Erica Lichter and Megan Baker, who is a MPH public health student. And they spoke about all of the different ways that we collect data in Maine related to breastfeeding. And specifically, what Megan did as part of her student work was she really drilled into the PRAMS data, the Pregnancy Risk and Monitoring System or survey data, and it was really fascinating to see. And so she's going to share, she has shared the PDFs of their presentations, and we recorded it as well. So that will go up on our website for people to view if you weren't able to attend live. I really look forward to using that data, since that should really be informing the work that we do. So that is what was happening yesterday. Today, I'm really looking forward to the presentation from Julie about developing lactation services in a primary care setting. And tomorrow is the virtual global latch on. So if you or you know anyone who'd be interested in participating in that, you can go to our website and find the link to register for it. I will put that link right in the chat box. And then at 12 o'clock tomorrow, we'll have some presenters from Jade Integrated Health speaking about the benefits of physical therapy and acupuncture on breastfeeding. So that'll be really interesting. And speaking of Jade Integrated Health, they are sponsoring today's meeting and today's presentation. So thank you to Jade Integrated Health for that. You can also see here on our site who our other sponsors are for our events. On Saturday, we have the exclusive pumping webinar. So some of you may be familiar with the website exclusivepumping.com, I believe it is. We all know people who either choose to exclusively pump or that ends up being their situation. So she's going to speak about she's going to give tips about how to make that the most effective, efficient process possible. So that's what we have coming up this week. And that is essentially what we have been focused on as a board, is planning those events. And our strategic plan is something that we're still evolving and looking for feedback on that. We might change that a little bit based on the data that we saw yesterday, really seeing more about what populations need the support and where they need the support. And so Tina, yes, if you missed that, we will have that up on our website as soon as possible. You may have noticed that on our website, we have last year's recordings still up for last year's World Breastfeeding Week. So you can access those still, and we'll do the same thing for this year. So that is that for now. I'm trying to think of any other updates. And that is one way that we are celebrating World Breastfeeding Week, is by offering these programs to professionals who support families who are breastfeeding or chest feeding, and also the families themselves who are breastfeeding or chest feeding. And having you all here today, I just want to put a verbal thank you so much for all the work that you do. This week is also like I was saying, for you to celebrate everything that you are doing to support families. Another thing that we've been doing, actually, Brianna Plord, I see, is on here, and she has been very active with our social media, and I've been so thankful. She just introduced herself, thanks. She has been creating lots of great posts on Facebook and on Instagram, and that has been great. So if you don't already follow us there, please do, so that you can see how she has gathered some stories from breastfeeding parents, and we are celebrating them through that platform. So I think that is it from me for now. And if you haven't already introduced yourself in the chat, please do. If I haven't really introduced myself yet, but my name is Kara Kaikini. I'm the board president of the Maine State Breastfeeding Coalition, and I'm happy to see everyone here today. One thing that I'll share now as well is, for that second part of our meeting, we have what's called the Connecting the Dots portion, and I am going to share a link that I like to keep notes in. If you have something to share, I've already put some in there, but you're welcome to type into that document. I'll also do my best to kind of keep track of some things that you share later on as well. Anyone else who is on our board, actually, I think what I'm going to do now, what I'd like to do to start our meetings is to read our vision and our mission. So I was able to just pull that up. Our vision as the Maine State Breastfeeding Coalition is that when every baby receives human milk, we will be a healthier Maine. And our mission is that the MSBC is a welcoming and broad network of people who support families who value human milk and breastfeeding. Together, we work to enhance the culture of breastfeeding around the state through professional networking, advocacy, and education. So again, thank you for being here. I'm going to put that in our chat box as well, so you know what our website is. Right under our vision and mission is a donate button. We haven't had a really strong fundraising campaign this week or this month, but we really do look forward to any, or we really appreciate any donations that can be made to keep our work going, especially as we have a pretty ambitious strategic plan coming up that we're going to dive into soon. So if you feel inclined to donate, you can go to our website and find that button to do that. All right, I'm seeing some people introducing yourselves. Thank you so much. Any questions before we jump into Julie's presentation? Is there anything I'm missing? Still bringing people into the waiting, or in from the waiting room here. All right. Well, Julie, if you are ready, I'm going to go ahead and introduce you. Julie is here today from Maine Medical Partners Pediatrics in South Portland, and she has been a pediatric nurse for 20 years, working in pediatric ICU, inpatient, continuing care nursery, and now ambulatory primary care. Julie was a CLC and is now working on her recertification. Nice job. Welcome. I think you should be free to share your screen when you are ready.
Okay, let's see. All right, can everyone see my screen? Okay, thank you so much for having me. I am so excited to be here. I literally could talk for probably 7 hours. So my colleagues have really tried to encourage me to narrow it. So I will try to be thoughtful. I am so pleased to see so many WIC individuals on the call. I have numerous shout outs to WIC, as I have learned so much from their programs across Maine and other colleagues. So really this presentation is, I'd love to have a conversation because we're constantly learning. Really looking at implementing lactation services in the pediatric primary care setting. Okay, it helps if I can, oh goodness. There, I've already I've already screwed up my. All right, let's try that one more time. Bear with me. All right, let's see. All right, round 2. All right, I can't turn my. Why won't it? It won't let me change my slides.
What if you use the arrow button on your keyboard? Does that help at all?
No, it's changing it on the side, but not on the. That's odd. All right, we'll get the exciting version of the. Are you still? Okay. What do you see? Are you seeing my second slide?
Yes, we can see your whole presentation. We can see your whole PowerPoint with the slides on the left as well. But I think if you, are you using 2 monitors?
Yes.
I think there's a way you can switch which monitor is being shown.
Yes, up here. I just did it. Let's see.
I know I was just doing this the other day too, and I don't remember which button it is. Anyone else is open to?
I think on the right, the monitor area is grayed. Maybe if you unclick use presenter view, it'll be the option to change the monitor.
I see.
No, that didn't do anything. Okay.
Did I do? Oh, it did it. It did do something. Let me go back to. Okay. I am so sorry. See, I could talk forever, but obviously I can't manage a PowerPoint. So are you able to see my practice now? Okay. So for those of you that aren't familiar, I work at Maine Medical Partners, South Portland Pediatrics. And just to give an example of what our team looks like here, we're comprised of pediatricians, approximately 7. We have 2 that are adolescent medicine specialists, so we see patients from 0 to 26. We have 2 behavioral health clinicians. We have a pediatric psychiatrist that we share with our colleagues. We are very, very fortunate to have an IB CLC, Christine, who's here on the call, and a CLC. We have a health coach. Our clinical teams are made up of RNs, LPNs, and medical assistants. We have patient service representatives and myself. So it's a large practice. Now it's not gonna, I can't believe it. There we go. So why is this practice important, or why is this setting beneficial to lactation? As we've really done this collaboration with colleagues, looking at various settings, reading the literature, this setting really offers a unique opportunity where patients are coming in frequently. Obviously, they need to come in with their support person, a parent. And it's typically the mom or the father, the primary caregiver, I should say. And these visits are frequent. So they typically come in within 1 to 2 days of being discharged from the hospital. They come back at 2 weeks, 2 months, 4 months, 6 months, 9 months. So they're coming in on a regular basis. We're able to develop a relationship with them and really communicate through various technology. It's also a setting where we do provide numerous procedures, vaccinations, and an opportunity to offer and support a mom breastfeeding following those procedures. We also have the support, kind of noting who is on our team, of the multidisciplinary resources here in this building. So really finding that, to have resources that I could just put, jump out of a room and go get somebody, or say, this person will follow up with you, is a huge benefit. Families are used to coming here. They trust the relationship they have with their care team. So it's a really nice setting to be able to continue that, but also to bring in the community. So by showing that we're partners within the community, then again, the family recognizes them as part of their care team. Seeing patients up to age 26, it's pretty nice to be able to not only see a patient that we may have established at birth, and guiding optimal nutritional benefits throughout the ages. Having started to collect data, we definitely are not getting all of our patients at birth. And so it is a mix of patients either moving or, establishing care elsewhere and then transitioning to possibly our practice. And just to clarify, for Maine Medical Partners, there are 5 specifically pediatric primary care practices. So that means they only see pediatric patients. It's not family medicine, it's not internal medicine. So we work very collectively together. And when we look at this lactation services, we really are talking about our family of 5. So the good news is I have not invented anything new. I'd like to say that I'm published, I have all these great articles, but I have just been the fortunate one to read these articles. I like to network and really ask questions. So there is an abundance of literature that is available that really encourages and supports the benefits of lactation services in primary care. So, when you read them, it sounds great, piece of cake. We can get this implemented, no problem. I'll say it's been a journey that we are still on, and without the help of collaboration, we wouldn't even be where we are today. Some of the articles that really stood out, and I would refer to others to look to first, is the American Academy of Pediatrics Breastfeeding Friendly Pediatric Office Practice. This is something that really hit the nail on the head for us because it identifies 3 key areas, which were environment, education, and collaboration. And obviously working in pediatrics, the American Academy of Pediatrics is our gold standard. And so having this to provide to our team to say, this is something that we can do and is recommended is kind of a no-brainer. So that is kind of our guiding light. The other program that I would give recognition to is the University of Vermont. I was inspired the minute I started doing my literature review by this study that they had performed. They put together a toolkit which not only gives kind of some basic breastfeeding tips, but really for me in the pediatric setting, it walked through each visit and a reason why you should be concerned or not concerned and how do you follow up. So it has these great kind of photos of this is good and this is bad, red flag. And it was really a great opportunity to say, you can do this at every visit and here's some recommendations. So a huge kudos to this setting for the work that they've done. I look at their site often for continued inspiration. The last one that I personally really have wholeheartedly invested in is, this happens to be the article, The Pediatrician's Role in the First 1,000 Days, but it's really the first 1,000 days. So what started as a journey for lactation services really expanded to optimal nutrition for the first 1,000 days. And obviously that complements with breastfeeding, but how do you introduce first foods and continue the support of breastfeeding? I have to say, my children are 18 and 20. First foods, I go look at the baby food aisle and I wouldn't even know which food to pick. So breastfeeding is a little bit easier for me. But again, as somebody who's leading this practice, I didn't know how to educate my staff on first foods. So this program really inspired me that there is information that's needed to help our families make those choices while continuing to support them in breastfeeding. So the first thing we did is start asking questions. I am one of those unfortunate people who can't ask enough. I have to understand why before I can move forward with something. And I have to say, it's so easy to read these articles and assume that people are on the same page as you. And that is so clearly not the case. We walked around the practice, a few of us, we've walked around our colleagues' practices and simply said, where would a breastfeeding mom go if she needed to have a quiet space? Do you allow breastfeeding in the waiting room? How would you support somebody that is looks uncomfortable or needs assistance while they're in the waiting room? If a family was breastfeeding after vaccinations, do you have another space to put your next patient? And again, they seem like very simple questions, but the answers that we got were surprising. Many people did not know what lactation services were that were on our team. Many people had not heard of a lactation consultant. Almost everyone did not know the community resources, and again, it's hard to hear some of the answers because I could have a stack of, handouts on these are the community resources. These are our partners. We've brought them in. We've done education. It's just like, okay, so we've done several modes of education, but when you go around and ask very simply, people did not know. And so if you didn't know with my kind of non-confrontational, question and answering, what if a family asked you where they would go or who they would turn to? A lot of the providers that we had at the time when we first started this really believed in formula, and they had formula in their desk, and they really felt bad for families that were struggling with breastfeeding and would offer it to them. And to understand why. When Maine Medical Center introduced donor human milk, we had no idea. There was a lack of education here about that. And so really saying, how do you feel about that? And let's have an open conversation. So a lot of questions back and forth. Unfortunately, I would love to say that we did this through a survey, that we tracked. We did not. It was all through casual conversations because a lot of people kind of processed what we were asking and then would come back to say, I really don't know. What equipment do we have? I don't know. And they'd show me something and then I'd say, okay. And they'd say, what about this? So it's this ongoing question and answering, and really to start somewhere. You would be surprised. It really gives you the barometer of where you're at. And we're asking questions all the time. It was a first step, and it's you can ask any of my staff that are on the call. Unfortunately, it's a constant step. I'm constantly asking questions because to me, that's how I'm really sensing whether or not we have an investment, engagement, and we've made progress. So the other first step when I'm asking questions, I'm also doing a tour of the environment. And this is one of the biggest things that we do when we introduce, to one of our colleagues. We recently went to Falmouth Pediatrics, Maine Medical Partners, and we did a walk around. And when we walk around, we're trying to do it from the patient perspective. So you come through the front door. What do I see for signage? And then I come into the waiting room. What am I seeing? Do I have space for my car seat? Maybe to get comfortable if I were to breastfeed? Do I have a quiet spot? Am I open to everybody? Am I sitting next to somebody who's coughing? What equipment do I have? Furniture, I could talk about furniture for seriously 3 or 4 hours. As you can see in this picture, this is a picture of a common exam room. That's what we started with for chairs. And I think I've spent hours, days of my life looking at chairs. So first, the chairs either had no arms or they had a huge hole. The pillows fell through, the baby could fall through. It's unbelievable what you can see in some places and what you can actually either get, purchase. So the furniture is another investment. What do you have? We actually used some of our waiting room chairs in the beginning because they were a little more comfortable, not much. Do you have designated space? And that could be for employees to pump. It could be for parents. Do you have space, like I mentioned before, if you have an exam room, so a provider is seeing patients, they typically have 2 exam rooms. If you have one parent who's breastfeeding after vaccinations, but you have the next patient who needs to come, do you have somewhere that the next patient can go so you're not moving the one who's breastfeeding? Is there quiet space? Is there space that has access to a refrigerator, water? What does the space look like? Is it friendly? Does it say Red Sox? Do I want to really see that if I'm breastfeeding? I have to say a huge shout out to Portland WIC. So I had the pleasure of visiting the Portland WIC office, and I was so jealous of their space. So visiting other sites for ideas, I was so taken back and literally went back and was like, forget the chairs. I want like this huge room. Their space had accommodations for a family that maybe had siblings, that an educator, lactation nurse could sit with a family at a table. They had a place for the scale. They had a place to change, diapers. It was such a friendly, inviting space that encapsulated education, family, support. I was so in awe. I also went to Maine Medical Center and saw their outpatient. They had a changing table. Okay, so if Joint Commission allows that, I'm getting a changing table. So it's things like that. I welcome anyone to come to this practice because it's an ongoing adventure of really finding what is perfect for your patients and families. I have learned so much by seeing other sites and really that wish list of, I love that picture. Can we get a picture? Can we get a plant? So this is what we've actually come to. I got that changing table, and then this chair in the corner here, I actually got through a yard sale that we have with Maine Medical Center. That sounds terrible, but it's quite a program, and I can't even tell you how proud we are to have that. But again, previously, even a chair like this, we used to use an exam room and we'd move the chair around. Hey, you know what? That was the beginning of a great start because it was at least comfortable for mom. And it allowed for kind of, reclining and whatnot. But as you can see in the picture, we're slowly trying to add something that makes the room comfortable, kind of that homey effect. So the mom feels welcomed, supported. Christine, our IBCLC, fits in there somewhere. I don't know how. The room is not as big as it appears, although in this picture, it really looks pretty big. The other thing I wanted to just mention is the impact on the team. So again, great, sounds so easy. Just find a room, you can put patients in it. It was an impact on the entire team. And so really starting the conversation with the questions of, how would you feel if this room became used for lactation? And it was really fascinating to me how territorial people became. A simple closet was a fight to the finish. I unfortunately told this poor triage nurse one time I was going to place her in a closet that was breathtaking. And she, I think, had PTSD to this day that I had said she was going to be in a closet. So ever since then, I've been very thoughtful about, noting what a space's potential could be. To engage the providers in this opportunity, it has to be multifunctional. So although this room we do call our lactation room, it is appropriate to see newborns in. You can see a newborn patient getting shots. So it is still multifunctional. And really looking at the space that you have, it is a difficult challenge to say, how can this be multifunctional? We've looked at everything from the IBCLC having an office where they go in, a desk. There's a lot more to it. So the environment is huge. Again, I would encourage to have open conversations because I love change. I could change things here every day and realize my staff really did not like that. So it impacted everyone to say, hey, I'm going to change this space up. What do people think? Unless people are engaged and committed to that change, it doesn't go over well. Not only will the space not be used appropriately, but it won't be appreciated or shared, celebrated as you are hoping it would be. The next thing that was a huge discovery for us is education and the lack thereof. The providers really indicated that they had no hands-on training. Many had minimal training during residency. Okay, so here as a lifelong pediatric nurse, how could you not be trained in lactation? But there's training hands-on and then there's book training. And it seems that they had all received some form of what they would consider training. But then when you tease it out, was it like you had a class one day and they went over breastfeeding and then you never saw a patient that you cared for that was breastfeeding? And so again, incorporating that, we did have several providers here who really felt strongly about advocating for formula. Where does this come from and how do we become advocates for these families? And we took a lot of time to really appreciate where people were at and how we could do better in the future. And so really introducing annual education, really partnering with our Maine Medical Center, who we're a department of, how can we make this better that from the time they are rounding or that they're doing a residency, labor, delivery, newborn, how can we impact that they have lactation experience? And that was just the providers. Our clinical and administrative staff receive absolutely no training. It is not any part of our orientation or introduction into specifically pediatric setting, which to me, again, was shocking. And unfortunately, I say unfortunate because I think when we talk about personal experience, it's often not always positive. So much of the education that people relied on was personal experience that they had, with one of their children, with a family member, relative that really stuck with them. And again, it was typically not a positive experience. And so that's where we started. The outcomes to where we are today, at the very least, and we still have a long ways to go, but where we are today is really looking at continuous education. We, again, I couldn't have done this without collaboration. So we partnered with the lactation team at Maine Medical Center. They started our education with the pediatricians by talking about the OBP's role in breastfeeding success. And then we really started embracing our community by talking about donor human milk, lactation services and primary care. We started using our own team here to really talk about education, basic breastfeeding, workflows here. Then we started really engaging. We try to do education as a team, so it would include pediatricians and our entire staff. So everyone from answering the phones, patient service representatives, medical assistants, LPNs, triage. So everyone was getting the information and really taking away their perspective of what their role was. We really found that focusing on the newborn as a whole was beneficial because to understand breastfeeding, you did have to understand sleep. And to understand sleep, you have to understand fussiness. And to understand fussiness, you have to understand the newborn. And so what it became was really this newborn education series to really ensure that people could take the time to appreciate breastfeeding and what that meant and the domino effect it had on the newborn and the family. We also partnered with the University of Rochester Medical Center. They had what's called Essentials of Newborn Care. Unfortunately, their prices have gone up significantly. When we took the program, it was a phenomenal program where our clinical staff could get a certification. They could get 20 contact hours. $100 got you 20 opportunities where you could engage a group into this education. The contact hours were a separate fee, but for $100, we tried to get everyone we could into this education. Unfortunately, now I think it's much higher. I think it's actually $700 for a group now. So we must have slid in right before. They must have had us and we're like, man, we're gonna increase our price. So I apologize, but that was a great program. If you do have the funds, I would highly recommend it. We had such an amazing opportunity to have Kara provide, information. So really using our colleagues to provide such knowledgeable, skilled presentations. And then again, one-on-one. So the IBCLC Christine, who's in our practice, really spending time with each role to say, this is breastfeeding and this is how it impacts your role. Do you have questions? Do you understand it? We also created a competency tool. So now people coming in for orientation, they do a skills-based, so it's really task-based, competency-based orientation for both CLCs and IBCLCs. Again, another shout out to WIC. I'm such a proud member of the WIC family, hopefully, is that when we visited, again, I probably could live there every day. When we visited, there was conversations about breastfeeding champions. And the reason that they had discussed this was there wasn't enough funding to send everyone to CLC training. And really, how do you take somebody's skills and experience and have them still engage, advocate, support families? And so they started to explain a role that they were really starting to develop there. What we did here is we began talking about the medical assistant. And if they became a CLC, in our organization, the medical assistant came to assessments, and really the CLC isn't necessarily an appropriate role. They couldn't see patients independently, but could the education lead to being a breastfeeding champion? And so really taking that. So again, thank you to our colleagues for always giving us education and information. And now we're moving towards annual education for breastfeeding. This is all about the entire team. It's not focused on one role or the other. We needed everyone to be on board. And really, it's from that first call from the family. If the person answering the phone does not understand what lactation services is, whether they're doing the first visit, a follow-up visit, we've lost the battle before we've begun. So making sure that everyone feels engaged and like they do have a piece of this. Technology, we're very slowly making changes with technology. We're working right now on piloting some lactation specific questions to really engage more of the families to ensure that breastfeeding is going well. Often we just say, how are you feeding, breastfeeding? Okay, is it going well? Well, if I am tired and I have a million other questions during my visit, I might forget that my nipple is sore. I might forget I have a red spot. So really asking very specific questions based on the visit that they're coming in for. Aunt Bertha, I'm not sure if people are familiar with Aunt Bertha. It is a national platform that people can look up resources. We will be adding, lactation services onto this, as well as our future in being a depot and dispensary for our donor milk bank. We're also working right now in collaboration with the Maine Medical Center on scheduling patients here. This is a huge opportunity. I don't work in the hospital. Apparently summer is peak time for lactation in the hospital. So we're hoping that we can offset some of this, but it's a great opportunity to collaborate. I think I've mentioned collaboration a few times. I cannot say thank you enough to all of the colleagues that have supported us along the way, including this coalition. We have learned so much, and we hope that this education, again, I could talk for 7 hours, and I know I've already gone way over my time. We would love to share. I would welcome anyone coming here. I would love to collaborate with everyone I saw sign up on the list. So really, this is so much a community impact that we can't do this alone for our patients and families that touch so many parts of our different settings and our different needs. So Sarah always likes to ask me how I measure data. So very quickly, I added this slide for her. Really, again.
No, you have plenty of time. You can talk for another 5 or 10 minutes if you want to, and then you still have time for questions.
Well, darn it, because I was hoping to skip this slide. So really, how we measure data. So I am the worst quality improvement individual, despite having previously worked in quality improvement. Again, when we started this, it was a conversation and really was an endeavor that we tiptoed into, and we were constantly asking questions and reevaluating and reevaluating. So we didn't even have any type of measure. When we would go to the hospital to join their lactation team meetings, they would say, how many people do you have breastfeeding? I have no idea. A few, a lot, I can't even tell you. Well, the funny part about our electronic medical record is that it's used across our entire organization of Maine Health. So what is used here at Maine Medical Partners is also used at Lincoln County, is used at Memorial Hospital. So we did develop a report. It is very early on. And again, that's why we're piloting more questions, because the question right now is simply, how are you feeding your baby? And we want to know more because breastfeeding might be breast by bottle or, breast at the breast. So there's so much that we want to make sure that we're getting the nitty gritty, and that I don't want to have to go into every chart. Is there a way that we can see more information up front and share it with our colleagues? So most of the times we refer to the state breastfeeding rates, which to me are a personal indication that we are falling short. When you look at that exclusively at 3 months and 6 months, to me, that's us. And really, that's where I want to see improvement. I might not be the whole state of Maine, but I feel like I'm impacting it. So when I see those rates, I celebrate those with our team to say, Maine is, one of the higher states. Let's look at where we are, where we've been, and where we could be. We will be surveying families, and so really making sure that, again, we're not assuming that we're asking families, have we met their needs? Is there something we could have done differently? And again, it's that patient journey. So it's different touch points. A lot of times here, we do get feedback about either the interactions they've had in the community or at another setting. So working collectively, we can share that feedback, as I'm sure there's feedback about us. Knowledge level and confidence. So again, are people feeling more engaged? Are they getting that first visit scheduled? Are they checking out and they say, yes, I can schedule you with our lactation consultant. Yes, I can schedule you again with the team at the hospital. Yes, I can refer you to WIC. We should be fluid in this, and we really should be able to support our families that are looking for help. Increasing our multidisciplinary partnerships. I think every day we are learning to connect in different ways. As we prepare for a celebration of our depot and dispensary, really reaching out to others. I will say that there's always some political tug of war. I think that's just the nature of the business, but making sure that we're in this for our community. And I think once, some partners understand that, then they're on board and to say, how can we collaborate? I have Intermed right next door to me, and I'm looking to collaborate because, again, it's about our community. And how do you do things, and can we improve for our patients? And hopefully sharing, effortlessly of what's been successful here that I would want another organization to be able to offer the same services. So that is actually the end. So again, it's a huge thank you to everyone for all the work that you do every day, for sharing your work and your knowledge and skill. We are so grateful to be able to begin this long journey to ensuring that this is a forever in pediatric primary care and constantly expanding upon it.
Julie, thank you so much. I'm so glad that you were here for the World Breastfeeding Week meeting to talk about this, because you and your program you're a model for how to make these collaborations work. So I want to thank you. And if anyone else is inclined to unmute themselves to actually give like a loud applause, please do. Otherwise,
well, and a huge shout out to the team. I unfortunately am the one who tortures them all by asking questions. So it's difficult because, to really promote those that are doing the work. And so a huge shout out to Christina, our IBCLC, to Dr. Rosenthal, who's our breastfeeding champion, to everyone who's working with patients and families. Kudos, kudos. I fortunately get to give the presentations and to get the positive feedback, but wow, every day, every patient, it is definitely an ongoing, you're learning something new. So again, and a huge thank you to WIC. If you'd like to give us any more design techniques, we'll take them. Education, sharing shamelessly. I think we've stolen all we can.
Oh my gosh, thank you so much. Does anyone have any questions or comments that you'd like to unmute and ask or type in the chat box?
Can I just ask a quick question? This is Mary Block, and it is so wonderful to hear what is happening in a primary care setting. I work up at Maine Gen as a lactation consultant on the mother-baby floor, but how did the seed get planted? Where did that come from to bring lactation to the practice? What was the history of that?
Oh yeah. So the interesting part is I am very much a hospital nurse. That is my experience. I will say that ambulatory is a little behind the 8 ball when it comes to education. When I joined here as a clinical manager, there had been a triage nurse who had shown interest in lactation and went on to get her CLC. When I started here, the goal was that we were able to carve out time for her to see patients. They had worked really hard to, get CPT codes and be able to do billing. We couldn't save those times because we always needed her for triage. And it became this constant battle with, today was her day to see patients. If we had a patient scheduled, obviously we would, she would need to see patients. But it was this slow crawl of people. So Dr. Jessica Rosenthal joining us to say, we really need to make this a priority. And then when you started to group together as a team, we were able to petition to then bring on, so Christine, as you can, I think she's right below me in the box. I feel like the Brady Bunch. Then we were able to request having another CLC hired because we just couldn't have the time that was needed for our triage nurse to see patients. And when Christine came on, I will say that she changed our program. She began as a CLC. We supported her through becoming an IBCLC. And then with that, our team of 3, fought the battle and gained force with the community. Again, partnering with WIC and their lactation team. It was literally a small seed that one nurse started, and it became a snowball that we all are constantly pushing.
How long did the process take from start to getting lactation services in the practice? Like a year, longer? What was the timeline?
I'd say at least 2 years. The nurse became a CLC, and over the course of a year, they worked on billing. They worked on attempting to schedule. She had very little luck. The second year, she began to see patients more consistently. And then I would say the third year, we were able to hire Christine. So by the third year, this is terrible to say, but from a business perspective, they saw it as lucrative. And so they were able to complement us in hiring a second CLC. Well, really, another nurse. So we termed, this was the first position that for ambulatory, we had hired as a lactation consultant. They didn't know what it meant. Despite being a department of Maine Medical Center, we had to create what the role meant, what it would be. Even now, I mean, when we look at the performance review, it applies and it doesn't apply because it's not ambulatory specific. So again, things like that, it's constant. We're constantly fighting. We would like to hire another one. Christine, sees patients for 5 practices. And, really partnering, we would love to partner with the hospital and their team who has, say 6 or 7 IBCLCs. I don't know for sure. But again, can we collaborate with others to bring them into our setting? Because this is a great setting, but maybe we can't get the team that we need. Can we collaborate with others to bring them in? So it's been a long journey. I think I've been asking questions since the day I started here, and it's been worth it. People have hung on and had some great answers.
And I think at the end of the day, you're serving the families the best, because as a hospital-based IBCLC, I have so much work on the floor, but half of my day is spent, making phone calls to our mothers who've been discharged, and we just can't, there's just so much work. There's just a lot of work that needs to be done. And really, the next step really belongs in that primary care setting where you guys are following up repeatedly. And so it's just so wonderful.
Well, I love Maine General. I'm happy to do a road trip. I would love it. But I have to tell you, so on the flip side to that, the interesting part is, yes, primary care is a great setting. The hard part is keeping up competency. And for that, we need colleagues. And so whether it's a supplemental nursing system, it's nipple shield, it's a premature infant, without having that constant kind of change in pediatric newborn practice, we need colleagues to keep up the skills. And so that's something, again, appreciating that the hospital-based lactation teams are constantly understaffed, overburdened. How do we keep up? So we have an ongoing conversation of how can we then keep up skills, because we're happy to help, but again, at the same time, there are some cleft palates. Those are babies, you don't typically see in the primary care. So we do want to get into the hospital to see them. So Mary, it's constantly about collaboration, because as much as we're happy to help on our side, we need each other. We constantly need each other.
Yeah, that's true. I hear you. Thank you so much. Thank you.
Yes.
And you've really shared, Julie, how to do that. So thank you for asking the questions and collaborating and leading the way. And for those of you that are here who work in primary care practices, please take what you've learned today back to your workplace. And if you know someone who could use this information, remember this is being recorded and it will be posted on our website. So we'll, if you're not already on our email list, then go ahead and put your email in the chat box and we'll add you to it. And we'll be emailing out when everything is live on our website again. Any other questions or thoughts for Julie before we transition to the next part of the meeting?
I just have a quick question. Oh, you can go first. Go ahead.
This is very quick, but I think I work with Julie. And so I think one thing that we're so lucky with is just that Julie is has endless energy and enthusiasm. So she is the perfect person to be championing this. And she also just knows the system really well. And so it's just a perfect set of sort of characteristics that has made this much easier in our office, because there have been a lot of pieces that need to be put together. And Julie just has so much energy and creativity around the whole process, which has been great. And Christine honestly has having her come on board has taken it to the next level, because she's just like great with families. And I think it's really important to have a person that has like the time to sort of follow up with families and just like think about the program. So it's just, I think that's part of what's made this so successful here, and that we're still figuring it out. It's not like we haven't finished, but yeah, I think for other practices, Julie is a great resource in terms of sort of a lot of the logistics and things that need to get worked out for sure.
Marie, did you have something to add or ask?
Yeah, just a quick question I was wondering about. So I know as far as education goes, sometimes formula sales reps will come into offices and hospitals offering gifts and education. So I was wondering if you have formula sales reps coming into your office, and if so, how do you deal with that, or how did you stop that from happening?
That is a great question. So Maine Medical Partners and essentially Maine Health had stopped vendors coming into the practices before I started. So I would say approximately at least 5 years ago, vendors were not allowed to come in. So that was a lot of the providers that had formula, had talked to reps, and they were really invested in it. I do still have vendors that come to me, and I have to say, I'm always looking from the educational perspective, because we do have families that use formula. And so it's one of those things, a balance of, is the vendor the right one to give you that education? And hence working with, others, because we do need education about formula. It's changed a lot. How do you stay up to date on it? And if you don't turn to a vendor to tell you about their product, who do you turn to then? And I think for our healthcare system, it's this huge shift of, okay, we don't have those vendors anymore. Then how do we get the information, and who is the expert? So no more lunches, no more trinkets, no more exciting things. For Joint Commission visiting our practice, actually, we can't even have bottles that would say like Infamil. So we got rid of everything long ago. So that was actually interesting when we started implementing lactation services, because we did need some volume feeds. We did need a few nipples to ensure that if, Christine was working with a family, she had the tools she needed. So then it became the opposite. Okay, well, I do need a nipple. What kind of nipple can I use? And does it have a logo on it? I can't use a logo. So vendors do reach out to me repeatedly. They are not allowed into our building. They contact me. I choose whether or not I get back to them. I unfortunately have shared with vendors that I'm interested in education, so they do send me a lot of things. We aren't even allowed to accept, say they sent me coupons. I'm not even allowed to accept coupons that are very identified through the mail. And so we wouldn't accept packages that then you open it and it has, samples or something. So we can't have any samples here. We can't accept any of that. But again, I'm constantly on the lookout for education, that if they were holding education, could I go and cipher out selling versus facts? And is that the place to go to get your facts? So we're fortunate that it's been mandated. I have to say, a vendor came the other day. He was selling, that sounds so funny. He was inhaler representative. And I said, you do realize you can't leave any samples here? And he's like, when did that change? I'm like, a long time ago. So yeah, I think the word's on the street. The only vendors we really have now are from the immunization companies, just to make sure that we have the information we need and whatnot. And again, they're not allowed in the building. I meet them in the parking lot. It's a very interesting endeavor, but Maine Medical Center has been working really hard, and that's another facet to kind of this lactation services on mixing formula. And I have to say, yes, we're 100% supporting breastfeeding, but we do have a lack of knowledge about mixing formula and supporting our families on how to do so appropriately. So it's this odd mix of then how do we train people, powder versus concentrated, and how do you learn? So somewhere in the optimal feeding, we actually partnered with Let's Go as well to help with that first foods and kind of the broader scope of formula, other options. Does that help?
Yes, thank you. That was really helpful.
Yes, once you just give them somebody else's phone number, and typically, you should see constantly the front's like, will you see? No. So they leave me messages, and then they know me well by now. I will reach out if I'm interested, but they know the answer is no, unfortunately for them.
Julie, thanks for mentioning the formula feeding and mixing work that Maine Med's been doing. I just looked up the guideline, and these are all public and available for anyone to see and use and bring back to your workplace. So just put that in the chat box. But it looks like that was updated in May. So recently just posted, and it's up on the Maine Health's pediatric guidelines under newborns. So just put that in there.
Well, it's funny, and it's hard. It's almost contradictory to say I support breastfeeding, but we're going to learn how to mix formula today. So it's one of those balances of how does this incorporate with our goal? But again, it's about our patients and families and their needs. And it was easily identified as lack of knowledge. What formula is recommended now? What is an alternative? People are always asking, what is WIC supplying? And so, just keeping up on that information.
Excellent.
I just want to make a comment on that formula mixing paper. I'm Sam. I'm from the Maine WIC State Agency Nutrition Coordinator. We worked with Maine Med on developing that, and we have it translated into 16 different languages. If anybody needs that, it's on our website. So we do have it available in other languages for you all. I can share that link for you.
That's awesome, Sam. So the guideline itself is translated, or is there patient education that goes along with that?
It's the yellow portion of that. So it's the visual part of it. We were taking into consideration that sometimes our participants come from countries where women are not allowed to learn to read. So we wanted to make sure that it was accessible for everybody. Yes, that part of it. Yeah, I can share those links with you right in the chat.
And I just want to take a quick shout out. Sam, I have to tell you, you have an amazing program at WIC, and I was in such awe to learn the resources and the services that you provide. I was so lacking in knowledge, and that was one of the first embarrassing things that we found. Like, wow, how has this been available? And to really promote it. Fortunately, now we partner with your lactation team and benefit from the support groups you have and the education that you have, and amazing. Kudos to you and the work that you do there.
We have a lot of people on the screen right here. Our local agency WIC breastfeeding specialists. So good job, everybody.
Yes, huge kudos. I mean, seriously, it's and again, it's so funny. The providers seem, at a lack of communication. Sometimes they just don't get the information because you go each day. I will tell you, Christina and I went for a tour of the WIC, and we came back. I don't think we stopped talking. Well, we haven't stopped talking about it yet. So amazing. And what a huge compliment to the creativity and meeting the needs of the patient. So what we're doing here is, in awe of what you guys are doing. So to collaborate together is, yes, awesome.
And we need to bring in our OB colleagues as well.
Yes.
That data presentation yesterday with the PRAM survey. One of the questions is, do you receive WIC services? And if not, why not? And 10% of those people who said that they do not receive WIC services said because they didn't know what WIC was. And I was like, oh my gosh. But it's also not clear if those folks weren't eligible anyway. And maybe they weren't told because it was known that they weren't eligible. But still, that's 10% more people, it's a lot more than what we want to see. We want everyone to know about WIC, and that can be a goal going forward.
Yeah, we actually just started a partnership with Let's Go, and they're going to do for the next 3 years. They're going to be working with us to really promote WIC and get us in front of providers. And so just as, getting the breastfeeding word out there and, letting people know what we can do and the services that we provide. But I did share that formula feeding graphic in the translated material section in the chat box. Thank you.
Excellent. Thanks, Sam. And thank you, Julie. I don't know if you're able to stay or not. I know some people are having to head off at 1 o'clock to go see patients or move on to something else. I hope that most of you are able to stay for the rest of the meeting, which is one of the best parts of the meeting, the connecting the dots and the networking and sharing all the excellent work that you're doing throughout the state. But we'll wrap up with you, Julie. Thank you so much. This has been
Thank you all. I do have to jump off, but thank you. I appreciate you all. I look forward to joining these meetings in the future. They're so exciting, so nice to be able to meet everybody. Thank you for all you do, and happy World Breastfeeding Week.
Yeah, thank you. All right, so everyone, I'm going to encourage you to stretch, do what you need to do to just be ready to transition to the next part of the meeting. I'm going to show, if you didn't see before, my shirt, my Eat Local shirt. I like the shirt. And what I'm going to do now is just go down the participant list and ask you to unmute and introduce yourself and where you are coming in from. If you can turn your camera on, that's even better, but understand that's not required. And share, let's see, I need to drop in the questions that we usually share here. I'll do that in the chat box. Let's see. Hold on. Okay. All right, so those are the questions that we generally talk about during this part of the meeting. We have what is happening legislatively that could impact your work. What else is going on in Maine that you'd like to share? What new research ideas have you heard about? What challenges might you be having in your workplace that we could all help you with? And anything else you'd like to share. So be prepared for when I get to your name. But Allison and Gina, you're there together. Thanks for changing your name, so we know that there are two of you here. What would you like to share? What's going on for you two? Hi. Oh, I see you're unmuted, but I can't hear anything. Can anyone hear? Oh no. Oh, no. Well, if we can't get audio working, then feel free to type something in the chat box so we know you are both always doing really great work, and we want to know about it. So please share however you can. And we can come back to you too if you feel like there's a little bit of tweaking you need to do on your end with audio. I think there might even be a phone number that you could call in if you wanted to. I'm not exactly sure how to do that. Amanda, if you have that info, Amanda Powell, to share in the chat box, please do. But we'll continue on for now. And actually, Amanda Powell, you are next up on the list to share what's up on your end.
Hello. Some of you know I also work at Maine Health. So I'm a program coordinator for the perinatal substance use disorder program and the child-led screening program. And one thing that we're working on right now, I was trying to think of things, that are relevant to breast and chest feeding. But one of the things we're working on is getting iPads, because there's a questionnaire that people with substance use disorder need to start filling out. And so we were thinking about adding that to an iPad and then having these iPads in the offices of women's health offices and adding education onto it. So if anybody has like their favorite breastfeeding video, we're looking for really short videos because this is going to be in the waiting room, or not in the waiting room, sorry, in the exam room when people are waiting for providers. So there's going to be a questionnaire that they need to fill out, and after that they can kind of look at other things on there. So it's been really hard to find good videos that aren't, for profit or something. So global health videos, thanks, Mary. Oh, yes, I forgot about those. I'll look at those. Also, things, because we were focusing on Eat, Sleep, Console, or things that are specific to substance use. And I really wanted to focus on positive parenting and other things, so it wasn't all focused on that aspect. So things around bonding, I found a good skin to skin one with Baby Central, but then they were like supporting formula on it too. So I knew that we couldn't really use that one. So yeah, any short video ideas that you all know about, I will take all of those. Thanks, Mary.
Awesome. Thank you. Yeah, I can share some other materials, but you're looking specifically for videos, you said.
Yeah, just because we didn't want any barriers with reading. We wanted to have like a video option that would be really short that people could go through. I was trying to find a good one around, like growth of the baby and things like that in the womb. But they were all very like scientific-y, and it'd be nice to have a more casual one,
All right. I'm going to drop this in the chat box. These are just a bunch of resources that I remember helping to put together several years ago. If you scroll down, it's not visible right away, but if you scroll down like each trimester, what are some good things to know, and some different links to those topics. So there might be something in there if you poke around a bit. Awesome. Thanks, Amanda. All right, let's see. Amanda Rosignol, are you there and able to, there you are, hi. Oh no, I can't hear you either. Can anyone hear her? Oh man.
Add in the chat the call-in options.
Okay. It looked like you unmuted yourself, Amanda, but we weren't able to hear.
Oh, can you hear me now?
I can hear, sorry, I can hear Amanda Powell, but not Amanda Rosignol.
Oh, okay. Wait, I'm gonna add the call-in stuff for Amanda and Allison and Gina.
Excellent. And so then we would still see your video, but your audio would be coming through your phone. If that's an option. Allison and Gina, any updates on your end? Audio updates? Can't hear you. Okay. Thank you, Amanda Powell, for adding that. And then we'll check back in with all of you. How about Carrie? Is it Louch?
It is, yeah. Hopefully my audio is working.
On you too. Great.
I'm actually super duper new. I am the new breastfeeding and outreach coordinator with Maine WIC. Yeah, so super excited to be here. This is probably the meeting on my calendar this week that I was most looking forward to. But I will actually completely defer to Sam because I know that there were a few things that she wanted to share out, if that's okay.
Yeah, absolutely.
Great. Thank
right
you.
over to you, Sam, if you'd like. Welcome, Carrie. When did you start?
A week ago today.
Okay. I was going to ask Sam if there were any updates on that position. So that's really exciting. Nice to meet you. I'm sure we'll be in touch quite a bit going forward.
I'm sure we will be. Thank you.
Sam,
So,
go ahead.
Yeah, I'll hop in. So I'll let our local agencies talk about. They're doing some great things for World Breastfeeding Week, which is really exciting. And virtual, in person. We're going to a farmers market on Friday to do a big latch on thing, and we have this little like a Polaroid picture type outline thing with like the hashtag World Breastfeeding Week and all those different things, so people can come and take a picture with their baby, and yeah, it'll be fun. But something that had come up today, we were doing promotional posts and just educational posts on the CDC website. CDC Facebook page about World Breastfeeding Week. And we all know breastfeeding it can be a sensitive subject for some people. And it just seems like we posted this post just about breastfeeding statistics in Maine, and like normalizing breastfeeding. And we tried to be very inclusive, and we tried not to, shame or sham or whatever. We tried to just make it just facts. And then when we got a message from the person that runs the CDC Facebook, and it just came up, and he was like, this is drumming up a lot of controversy. There are 60 comments on here. And it's just like, and some of them are very positive, like thanks for sharing this. Great, great World Breastfeeding Week promotional materials. There are some people talking about like, yeah, breastfeeding would be great if we had paid maternity leave, and just all of the concerns and things that come up when you're discussing breastfeeding. But we are not allowed to comment on that as state employees. We're not allowed to, like, I wanted so badly last night to be like, well, let me, I wanted to be the keyboard warrior and go in and like answer every single question, but we're not allowed to do that. So I was wondering if anybody has access to Facebook and they can look at the CDC Facebook page and just look at the World Breastfeeding Week posts that we put out. And maybe, I know that you guys are your warriors for breastfeeding. So if anybody has any input or feedback that they could give us, or maybe help to answer and educate some of the people's comments and questions, that would be great. Of course, like, I got all fired up about it, but I was told by my supervisor to stand down and not allowed to get on that train. But yeah, so that was one thing that came up that we are struggling with right now, or I'm struggling with right now. But other than that, our local agencies have been doing really great things for World Breastfeeding Week. And we have our new breastfeeding outreach coordinator, Carrie, she came from Delaware. So we made her move all the way up to Maine. So thanks for coming up, Carrie. And we also have our annual conference, the Breastfeeding and Nutrition Conference. So we have it on October 1st. We have a presenter from California. Her name is Alicia Simpson from Peapod Nutrition. She'll be talking in the morning about nutrition, but in the afternoon, she'll be talking about current techniques with breastfeeding and peer counselors. So if anybody would like that link and would like to join us, it's virtual. So I have permission to share that out with anybody who would like to join us, and you can get some credits for that too. So you just let me know about that. But thank you for having us all here.
Yeah. Sam, is that a link you could put in the chat box so that we could share it in that Google Doc for people to have access, and also in our notes?
Yeah, I will do it. I have a save the date. It's through Microsoft Teams. So I'm not sure if I know how to do that, but I can send the invite to you, Kara, if that works.
Whatever works, so we can share that out. That sounds interesting.
Awesome.
And I did put the Facebook page link in the chat box there. I know that can be really tough. First of all, thanks for putting that out there in Maine City. It's very visible. Hopefully a lot of people are able to see that. Such a cute picture of that baby. I can see. I'm anxious to read through the comments, and I know it can be really tricky to know how to respond, when to respond, and when to just allow that conversation to happen versus when to offer some additional education for folks that might not be informed in one way or another. What are some other thoughts on that? I think this is a great time to chat about that a little bit. Are there times when you've been in that kind of a situation? And how have you handled that? And what else have you been seeing? I feel like I saw in another Facebook group, I don't remember which one it was. It may have been the LactNet, it's not called LactNet anymore, group, but talking about, I guess New York Times had a full page ad about feeding. They crossed out the word breast, and it's just feeding. It was kind of controversial. So are there some other things people have been seeing, and what are some other thoughts? How can we support one another through these times of controversy?
I will say that we, even though some of it was, it was controversial and, some false information being shared, we were kind of excited because we were like, at least people are talking, right? Like, at least it's drumming up a conversation and allowing a platform for people to be able to express their concerns and their thoughts. So even though I was a little bit bummed out, I guess that is a positive that came from it.
Mm-hmm. Yeah, and it can be a delicate balance. I mean, we're all here to support breastfeeding and chest feeding, but also families in general and parents in general. We understand how hard it can be. And, we don't want to come across as being forceful or pushing or pressuring people. So how do we offer that education and that support without coming across, without adding any shame to anyone who has had a challenging experience and have had to make other decisions, feeding decisions than what they wanted to. All right, well, thank you for sharing, Sam and Carrie. Next up on the list here is Jennifer. You're muted.
Me, Jen Vijay?
Yes, you, Jen Beecher.
I don't know if there's another Jen. Yeah, not a lot going on in York County. We don't see a lot of people in person yet. So a lot of our World Breastfeeding Week stuff has been online. We keep it, we do a daily post and that sort of thing. I did see the Facebook post that Sam was referencing earlier, and I'm like, how can data be shaming? Like, it's data, it's facts. But I just saw it turn. Like, I'm like, how did that all go from there to there? But it's interesting to say the least. But as far as York County goes, we're just still plugging away. A lot of our participants are seen remotely. If there's any breastfeeding concerns, we do bring them in to weigh them. We've lent some scales out to weigh if there was any concerns in that aspect. And then we are bringing them in person and seeing them if there was any concerns too.
Awesome. Thank you. Thanks for continuing this work that's still amid a pandemic. Okay, next up is Lindsay Mitsopoulos.
Hi. So not too many updates here, but we did just start seeing clients back in person this week. So it's been a little bit busy here, kind of getting used to that transition and clients getting used to it. So we're doing a mailing for World Breastfeeding Week. So we have some breastfeeding bras, and we're going to be sending people a bra and a little postcard that Anna made. Not too much else, but I did have a client yesterday who called me and said that she thought she needed to stop breastfeeding because she just got the COVID vaccine. It made me think about it when Sam brought that up about trying to support parents in their choices, but also not wanting to shame them, because this mom really felt safer switching to formula. So that was a really difficult conversation to try to navigate, because I obviously wanted to encourage her to continue breastfeeding. And I explained, the science behind the vaccine, and I sent her some articles, but I didn't want to, say, I'm not going to give you formula because I don't think that's the right choice. So that was a little bit tricky. So that was the first client I've actually had who has said that. I have had some other clients with questions about it, but this was the first person that I spoke with who actually wanted to wean from breastfeeding. So anyways, I sent her some articles from the CDC and the Academy of Breastfeeding Medicine, and we had a long conversation. I did load a couple cans of formula onto her benefits card for WIC if she felt she needed it, and I'm going to check back in with her today and see where she's at. So but yeah, that was kind of an interesting thing that came up for me yesterday. So
It sounds like you did just the right thing, Lindsay.
Yeah. You tried. But it's good to know too that information is out there. I don't know quite where she was getting the information, but she definitely saw enough that made her feel very nervous about it. So yeah.
Excellent. Lindsay, and if you have that information, those resources handy that you use, I don't know if you emailed those to her.
Yeah.
You can copy and paste those into the chat box.
Yep.
Or that Google Doc, that'd be great. And that might be a post that the Mainstay Breastfeeding Coalition could create. I'm not sure if we've done, it may have been a while since we've done anything to share the safety of the vaccine. Perfect. Thank you.
Yeah, I just did CDC and the breastfeeding medicine, so I'll pop those in there right now.
Yeah. And Sam, I don't know if the Maine CDC has done any posts on that recently, but that might be another good World Breastfeeding Week post about the safety of the vaccine. Excellent. Thank you, Lindsay. Okay, next up is Marie Robinson.
Hello, this is my very first Maine State Breastfeeding Coalition meeting. I would guess that I am the furthest north person in the meeting. I'm in Presque Isle in Aroostook County, and I work at the hospital here as a labor and delivery nurse, and I'm also an IBCLC. So that's about like 2.5 hours drive north of Bangor. The struggle up here is just the lack of support and people and providers that you can refer to up here compared to what you all are probably used to in your area. So that can be a challenge. And I do apologize if you hear my children at some point here. But I'm in the beginning stages of working with Kara on ways to collaborate and improve access to services up here and find new ways to make those resources available. So that's what we're doing.
Awesome. So anyone else who is in more of a rural area, do you have any suggestions for Marie, any tips that you would like to offer? Either you can unmute if you have anything right in the top of your head, or you can type in the chat box or send her or me a message if you have any thoughts on how to best support her in her environment. Glad you're here, Marie.
Thank you so much.
All right, Mary Block, you are up next.
Let's see what's happening. I'm at Maine General as a hospital-based IBCLC. We've just changed our visitor policy back to less restrictive a couple weeks ago, and it's been such a nice reprieve from having visitors in the room, because we can do a lot more education, and so having more visitors back in the room has been a little more difficult. I imagine it might be getting changed back again coming up. We're very busy. And then the only other thing I'd like to add, I'm a Lactation League leader with the Portland group, and just want to let folks know that Lactation League of Maine and New Hampshire is running 2 virtual meetings every week, Tuesdays 7 to 8 and Friday mornings, maybe 9:30 to 10:30. On the website, you can get that information, and they're free. Of course, we are not having our support groups at Maine General right now, but Lactation League of Maine, New Hampshire is. So thank you. Always great to be here.
Awesome. Thank you, Mary. On our that Google Doc that I've mentioned, and I'll actually drop that in the chat box again here for you, for people that want to use that and look to some notes that we've been taking. We do have that listed, the Lactation League of Maine, New Hampshire website. So I'll add those times in there too. Thanks, Mary. Petra Kaur, you are up next.
Hi, I'm Petra Kaur. I'm with the MSBC board, and I'm a Lactation League leader. Not too much going on. Lactation League Council, we are supporting all of our groups and areas in their Live, Love, Latch events, which always happen during World Breastfeeding Week. And this year, we've actually coordinated a national Live, Love, Latch virtual 5K. Which has been going really well. People are sharing their pictures on social media, and when they complete certain milestones, they get medals and t-shirts and things like that. So it's been an interesting year to hold the Live, Love, Latch events, but it's working out well, I think.
You have a link you could share to check that out?
Sure. Most of our Live, Love, Latch stuff is on just the Lactation League USA social media sites, but I'll drop those in the chat box for you all.
Thank you. And we still have, I think you had shared last time, the LGBTQ group through the Lactation League. That link on Facebook is on this document as well.
Yes.
brought that forward from last month.
Yep.
All right. Thank you. Rihanna?
Hi. My name is Rihanna. I am the breastfeeding coordinator for WIC in Bangor. We cover Penobscot and Piscataquis counties. So some updates, kind of a little scatterbrained today. Today's a big day. We have our drive-through event for Well Breastfeeding Week. We're holding that at 2. So I do have to jump off right after this and get ready for that. But basically, participants were invited to drive through in the back of our parking lot. We have a bunch of goodie bags with breastfeeding education materials, also breastfeeding support items, fun items too. Like we have pop sockets for phones that support breastfeeding, like soup containers, socks that say if you're reading this, I'm a breastfeeding mom or something like that. So that's really cute things. We have like 4 raffles with awesome giveaways, like a Target card, like just things that could support them in, breastfeeding and whatnot. We've been active on social media with posts, and then also we've been doing a daily Facebook Live, and we've had different topics every day. So for the first day on Monday, we actually talked to a new breastfeeding mom. She has a 4-month-old baby. So we asked her some questions and then kind of did a question answer kind of dialogue between me and the breastfeeding peer counselor, Mitchell. So we did that. We did the second day as a shared responsibility and family support. So talking about how family and friends can support breastfeeding with you. Day 3, we talked about the Maine state breastfeeding laws for the workplace. And then today we did myths and facts, just some random, things that we hear a lot here in the WIC office. And then tomorrow it actually goes, I don't know who was talking about the COVID guidelines, but tomorrow we're talking about updated COVID guidelines with breastfeeding, talking about both all from CDC, what they recommend about breastfeeding while having COVID, and then with the vaccination as well. So we'll be hopping on live at 11:30 on our Bangor Public Health and Community Service Facebook page. So we'll be doing that. And then, yeah, big week. And then, let's see. Other than that, we have a newborn nutrition class that we are doing bi-monthly. We had a great show rate this past month. We had, I think, because we have a capacity of like 10, and we had like 6 or 7 participants that showed up on Zoom with Mitchell, our breastfeeding peer counselor, and it was awesome. She said it was a great class. She got to talk to so many breastfeeding moms. So, and they all get a gift for just attending too. So it was awesome. Other than that, I think that's all the updates that I have had. We did have a comment on our Facebook Live the other day about, because we were celebrating World Breastfeeding Week, and we did have a comment saying, with someone saying, what about World Formula Day? So we addressed that because it was a live comment, and we, said that we support in every which way, and this is just a world event, and we're just, trying to celebrate our breastfeeding moms too. So we were able to address that during the Facebook Live, but yeah.
Awesome. Thank you. Thank you so much, Rihanna, too, for everything you've done for the social media pages for Maine State Breastfeeding Coalition too. It's been really helpful on our end, and just so great to have so much engagement and so much of a presence during this time. Appreciate
You're welcome. It's been fun. I've been enjoying talking to a lot of the breastfeeding moms and being able to share their stories. So, but I gotta hop off. So thank you.
Have fun. And Dr. Cora, I see your additional chats about the Lactation League USA Facebook page and the different things that posts that they'll have throughout the month. And we might, if we're able to, I think that's something that Rihanna and I have talked about, just like resharing all these other wonderful posts that are being made through the USBC and through the Lactation League. So we'll be keeping our eyes open for those. Sam, you were up next. Do you have anything else to add in addition to what we were talking about before? Okay.
Yep. Thanks.
Great, thanks. Tina, you're up next.
I'm the peer counselor for the Mid-Coast region for WIC, and for World Breastfeeding Week this year, it's always a challenge for me because I always want to come up with something creative and new and exciting that we've never done before, and it's always like, I don't know what to do. But we came up with the idea this year of sending a video text to all of my moms, all my clients, and it's been really well received. It's been kind of cool. Just wishing them World Breastfeeding Week, happy World Breastfeeding Week, and reminding them of my support and my YouTube channel and my Facebook page. And I asked if they were interested in a raffle to just type "I'm in," let me know, and the response has been really great. So we're doing up a basket, mostly for moms, with I think we had Burt's Bees, like a mama kit for foot rub and fuzzy socks, and then there was letters to my baby notebook that they can fill in, and so just kind of a fun basket for mom with all kinds of goodies. So been a great response. People are like, oh, it's so great to see your face, you know, because usually it's on the phone or I'm texting them or whatever. So so yeah, that's pretty cool. I'm pretty excited about that. So not sure really what else is going on. I don't know if Lisa's here, if there's anything that she wanted to update, but that's what we're doing for World Breastfeeding Week this week. So yeah, pretty excited about that.
Awesome. Nice work, Tina. I think that's a great example of how it doesn't have to be a giant event that you do. It can be something just really sweet and special that is.
Yeah. And I think they like that, you know, and even when I was out in clinics during World Breastfeeding Week, or when I've gone to the Topsom Fair, just seeing someone face to face, whether it's a video or, you know, after talking to someone for months and they're like, oh my gosh, like, you know, it's just more of a connection, and it's been good.
Yeah, great. All right, I think we're at the phone numbers now. So I see two phone numbers. I see a 795-4016. Go ahead and unmute and introduce yourself.
Hi, this is Amanda Rosignol.
Excellent.
Can you guys hear me now?
I can hear you and see you, yes.
Okay, great. So I am the breastfeeding coordinator for WMCA's WIC program. And for World Breastfeeding Week, we have been working on getting our a new breastfeeding room for our moms together. So we did that. We got a grant to help us. So we got some new furniture and a nice TV so we can play like videos and music and just have a great place for moms to come in and either nurse their babies, pump, or meet one-on-one with our peer counselors or any other counselors on staff. Just have a quiet, nice, relaxing place. So that's what we have debuted and this week, and we're hoping to do more with more of our moms going forward throughout the rest of the month. And we also have a raffle basket too that we'll be giving out. We have people, our breastfeeding moms, write down like what breastfeeding means to them, their favorite part about breastfeeding, or how long they've breastfed, some little like tidbit about that, and then it'll all go into a raffle basket that we'll give out to at the end of the month, just with breastfeeding goodies for moms. So, and then other than that, that's pretty much it.
Awesome. Thanks for doing all of that. It can be a lot. And some of us, it'd be great if World Breastfeeding Week was in like March or some other month that's not quite so busy. But you're all pulling it off. So nice job. Thank you. And thanks for hanging in there and calling in as well. It's good to see your face and hear your voice too. And I'm guessing maybe that other phone number, oh, it may have disappeared. I don't know. Allison and Gina, is that you? Did you call in? Are you on the phone? Yay.
Sorry, we are having some pretty severe issues here. This is Allison and Gina from Maine General WIC. For World Breastfeeding Week, we have some little vinyl stickers that we've made up that moms can put on their cars or water bottles or wherever they want. We have some fun goodie bags with stuff in it. And then we made up some breastfeeding certificates that we can give out to celebrate any amount of breastfeeding that they may have done. Do you think anything else?
No.
Before I unmute us
That's
and
it.
potentially hang up again.
Awesome. Thanks for calling in and reporting out and doing all the work that you're doing. And it's cool that you guys get to join the meeting together. And maybe someday we'll do this all in person again. We'll see how we go forward. I think for now we'll continue with the virtual meeting. It's really nice. I think we get more people joining when we're virtual like this. Yeah, it's good to see you, and thanks for being here.
Thank you.
I will go ahead and just mention a few things that we have on that Google Doc. Like I said, we're still accepting feedback on our strategic plan. Let me see if I can copy that link if you want to take a peek at that and see if you haven't seen it already. You're welcome to take a look and then give some feedback in this survey here. And you're welcome to email us at any point too at mainebreastfeeds@gmail.com. And in, let's see, September 1st, I'll be doing a webinar through the Perinatal Outreach Program about milk supply. So as you know, that's one of the biggest challenges people have and the biggest questions they have. So I'll be talking a bit about the difference between perceived and true insufficient milk supply, and talking about counseling and communication strategies around investigating low milk supply, and then coming up with some plans to optimize milk supply in a few different scenarios. All right, good to see you, Allison and Gina. And then there's some resources in the document as well, some that were carried forth from last meeting, and then some that are new that we just shared today. Legislative updates, we have paid leave, the legislation to create a commission to develop a paid leave program was signed by the governor. It was passed. And so the next step is to actually create this commission and bring all the appropriate people onto the commission to do the work to then develop a paid leave program that would then be voted on and so on. So that's exciting. The donor milk, main care coverage for donor breast milk, that got carried over to the next session, just like it did last year. So we'll keep our fingers crossed that the next session that will actually go forward and get funded, and we'll start to see something happening with main care coverage for donor milk. And the act to provide women access to affordable postpartum care also became law. All of this information is in that document. And then the paid leave coalition that I'm a part of, they just sent some notes from a meeting. I wasn't able to make it, but in their notes, they were talking about having ice cream socials and coffee hours, one in Brunswick, one in Lewiston, coming up August 21st. So if people want to learn more about paid leave, they can go to those events. And there's also Women's Equality Day rally that the Maine Women's Lobby is working on. That's Saturday, August 28th. And the Paid Leave Coalition is also doing these small business info sessions for, it's actually put on by the Maine Small Business Coalition, and they are also known as MSBC. So the Maine Small Business Coalition will be doing a webinar to go over the current state of paid leave and the ways it could impact small businesses, and then invite those business owners to be part of the advocacy efforts, because we definitely need to hear their voices and understand their challenges and see what recommendations they have too. So that's a little bit about paid leave. And I think that's basically what I have in that document for updates. Before in the past mentioned, the USBC is such a great resource. And if you don't already get their weekly updates with national updates, then I recommend becoming part of their email list. We did, as the Maine State Breastfeeding Coalition is now a member of the United States Breastfeeding Committee, and so we're excited about that. Anything else? What else do folks have to share? What questions might you have? Now is a great time to connect. Otherwise, I'm just going to keep talking for a few more minutes. I'm going to share my screen that will share what you've probably already received, which is our newsletter. The past several newsletters have included this information about National Breastfeeding Month, which is, so we have our World Breastfeeding Week this week, and all of August, thanks to the United States Breastfeeding Committee, is National Breastfeeding Month. So next week will be Native Breastfeeding Week. And if any of you have connections to Native populations in the state of Maine, please let me know, because I would love to connect better with those groups and help celebrate breastfeeding among those communities too. I have a few people that I could connect with, but I would love to know if you have other folks that you think would be good to connect with. Please let me know. Week 3 is Asian American, Native Hawaiian, and Pacific Islander Week. And then week 4 is Black Breastfeeding Week. So we'll be doing really more social media around those weeks, just to build up some awareness and celebrating in those areas too. And then coming up for our next meetings, October 7th is our next meeting, which, does that seem like a really long way away? Oh my gosh. And the topic will be Advocacy 101, and Brooke Barron, who is on our board, who just had a baby. So she's not here today, but we just want to say congratulations during this meeting to her and the birth of her beautiful baby. She will be speaking about, just in general, advocating. What does that look like? How does that look like in terms of breastfeeding? And we'll speak, in the past, we've talked about how folks like people who work for WIC, for instance, what are your limitations when it comes to advocacy? What can you do when it comes to advocacy? And clarifying that a bit. We have some resources we can share. And if you have anything new you want to share, please let us know, and we can certainly add that in, or just be there for the meeting to talk about it too. And December 3rd, we'll have Paula Norcott from Maine Mother and Company. She's also a lactation consultant at a couple of different hospitals in Maine. She'll be speaking about the impact of the birth process on breastfeeding. So that will be a great presentation as well. And then if you have other ideas for topics going forward, we will be talking soon about 2022 and coming up with our topics for those meetings, and we would love your ideas. So please email us or unmute yourself and share any ideas that you have now. And we have a smaller group right now, but we do tend to end our meetings with what we are taking away from the meeting. So we're just going to go quickly through the participant list again and just take a minute to say, what are you taking away from the meeting? And I can go first and just say that I'm so inspired by Julie Beecher and the work that she's been doing. And also psyched to have had, I think we had 28 people in today's meeting. So that is always really inspiring as well, and keeps us moving along in the work that we do. Amanda, you are up next on the list. What are you taking away from today's meeting? Amanda Powell.
I agree. That was a great presentation. I like to see how the lactation room evolved. And I want to know more about this Maine Medical Center yard sale that's going on. That sounded very interesting. But yeah, I appreciate everyone for being here and being our community. It's great.
Yeah, I really loved how she spoke about doing a patient perspective walkthrough. Like, that's so helpful to do that, just as if you were a patient walking through your environment. And that can be great in all offices that we all work in. If we work in offices where we see people, what is their perspective? Awesome. Amanda Rosgnaw, I don't see your phone number here now, but you're welcome to chat in the chat box, anything that you're taking away. And Carrie?
I'm just thankful to be joining this group of, incredibly dedicated and educated and helpful individuals. And I'm looking forward to getting to know all of you.
Excellent. Same here. Carrie, could you put your email address in the chat box, either if you're okay with everyone having it, that'd be great. Otherwise, you can send it just to me in the chat box.
Yeah, of course. Not a problem.
All right. And Jen Vijay.
Hi, I'm taking away all the great information that Julie did share, and how collaborating with other groups. It was awesome to see. And it was a great idea seeing it from the client's perspective. I'm looking in my office right now, which I share with the health center. I'm like, so I'll make some changes. So thank you so much.
Thanks for being here. Again, you're so dedicated to our meetings. I so appreciate it. One thing Julie and I were talking about before everyone came on is how much she loves vinyl stickers and how I don't know if she said that during her presentation or not, but it's so easy to wash and they can really spice up a room, which is nice. Thanks, Carrie. All right. Scrolling here, Lindsay Matsopoulos.
Hi, it was really fun to hear about everything that people are doing for World Breastfeeding Week, and same, hearing Julie's talk was awesome. I spent a day with Christine, the lactation consultant there a few weeks ago, and their setup is really awesome, and Christine is amazing. So hoping that more primary care practices will take on that, start hiring lactation consultants because it's so valuable. So thank you.
Awesome, thank you. And hugs to your baby from me, who I still haven't met in person, but someday I hope so. Marie, you're up next.
I just want to say how refreshing it is to just learn new names and, hearing about all the work that other people are doing in the state. As a La Leche League leader, I'm used to being connected to all my awesome leaders in the La Leche League of Maine, New Hampshire. But I'm really happy I connected here so that I can really see the full picture of everybody who is working so hard for babies in the state of Maine. So thank you, everyone.
Thank you, Marie. Thanks for representing Aroostook County here as well. All right, Petra Kaur.
I think it was really great seeing so many people here today, and I really loved Julie's presentation. I also really love that Marie is here today because being from Bangor, I think a lot of times we feel like the state ends at Bangor and we kind of forget about Aroostook County. So it's really nice to see you here, Marie, and I hope that you join in more often because it would be nice to have that voice from up north.
Well, thank you so much for saying that. I appreciate it. I'm glad to be here too. I'm really gonna make every effort to come in the future too.
Okay. Sam, you and your awesome background are up next.
Thanks. I'm just excited to be a part of this group and see everybody's faces and hear what's going on around the state. But I am really excited to start to go into our local agencies and look at them through the lens of what a participant or what the general public would see. So that's definitely something I'm going to take away from today. Thank you for having us.
Yeah, thank you, and all your excellent leadership as well. Tina, last but not least, I think.
The presentation was awesome. I really enjoyed it because I think, having 4 kids and just seeing the evolution of the connections that are being made. I think sometimes in the past, there's been a lot of disconnect between the pediatricians and the whole breastfeeding community in general, and like she touched on the lack of sometimes the education that they really have in regards to breastfeeding is huge. So anyways, I was really happy to see that and to see those connections being made. And of course, I love always hearing about World Breastfeeding Week and what everybody's doing. And I can't, during the normal school year, I can't be here for the meetings usually on Thursdays. So the summertime is when I try to take advantage, but I do like, keep recording because I do like to watch them, so.
Yes, and even when you're not here, I know that you're there. And that you're there. You are also a dedicated person to this in this community. So thank you.
Thanks.
And to everyone who's still on this 2-hour-long meeting, you're all very dedicated. So thank you for being here. And again, happy World Breastfeeding Week to you all. And thank you for your commitment and dedication to the families that you work with. It's all very meaningful. Any last thoughts or questions before we end? All right, I think that's it. Enjoy the rest of your day, the rest of World Breastfeeding Week, and enjoy your summer as best you can amid all of your work and life in a pandemic.
Thank you.
Thank you.
Bye.
Thanks.